Okay, welcome to our presentation. We're group 30 and we did Lyme's disease, aka borreliosis. Our group was Bryan, Firstish, Caulder, Biddle, Johnny Shermer, and myself, Jay Yeager. So the main Lyme disease causing agent is known as Borrelia burgdorferi, which has a spirochete shape. This agent is special because it is neither gram-negative nor is it gram-positive. Instead, scientists have deemed it diderm, which means it has a double membrane. It still has peptidoglycan, but the periplasm lacks ATP. The disease is brought to humans through bites from infected ticks. Here, you can see some of the common signs of Lyme disease. They are broken up into two categories, early and late. A few days after being bit by the disease-carrying tick, the victim will start to feel some common sickness symptoms, such as fever and body aches. The first and major sign of an infection, however, is the appearance of a bullseye rash, also known as erythema migrans. Erythema migrans can go unnoticed for some time depending on the location of the tick bite, as the victim cannot feel its presence, meaning usually has no pain or itch. More severe signs and symptoms can show up much later. The more obvious signs of infection are heavy swelling of the joints, often in the knee, and facial drooping known as Bell's palsy. Personally, as a child in New Jersey at the time, I had Lyme disease, but never had a bullseye. It was not until my left knee swelled up that I went to the doctor to get tested for the disease through a series of blood tests.
There's about 300,000 people diagnosed with Lyme disease every year in the United States, and this number is rising. 96% of the cases are concentrated in 14 states in the Northeast and Upper Midwest of the United States, which include Connecticut, Delaware, Maine, Maryland, Massachusetts, Minnesota, New Hampshire, New Jersey, New York, Pennsylvania, Rhode Island, Vermont, Virginia, and Wisconsin. Public funding is very low for how many cases it has per year. The funding right now equals about $133 per patient, while HIV or AIDS is about $57,960 per patient, and there's only about 50,000 cases per year. Lyme disease is concerning and is a disease on the rise that should be more well funded. As said before, the bacterium that causes Lyme disease is Borrelia burgdorferi. It is spread by the bite of a tick, in particular a blackleg tick, and the western blackleg tick. Cases in the northeastern and Midwest United States were most likely caused by the blackleg tick, and cases on the Pacific coast are typically caused by the western blackleg tick. On the bottom, you can see the different stages of the tick's life and the size of the male and the female. Take notice of how small they are. Most infected bites come from the younger ticks called nymphs, seen on the previous slide. Nymphs are the most common for infecting humans because of how small and hard to detect they are. The best spots for them to attach to humans and where they will least likely be noticed is the armpit, groin, and scalp areas. For Lyme disease, it's important for them not to be noticed because it takes about 36 to 48 hours for the bacterium to be transmitted to the host. When a tick finds a spot to feed, it will grasp the host's skin and dig into it and insert its feeding tube. Some species are known to secrete a substance similar to cement to allow it to stick to the host and not move too much when the host moves. Some also have barbs on their feeding tubes for the same reasons. They also secrete saliva that has anesthetic properties, allowing the tick to go unnoticed once it is attached. This helps the tick be able to stay for days feeding on the host blood. The tick will suck blood from the host very slowly for several days, and this process is when diseases are spread like Lyme disease. The tick can acquire diseases from the host and or transport diseases to the host during the process. For example, a tick could feed on an animal of the forest that has the Lyme disease bacterium, which would be down on the tick. And then the tick could go on and find a hiker to feed on and transmit the bacterium to them during the feeding process.
Next, we have the pathogenesis of the bacterium.
The incubation period is between 3 to 32 days. Genicity mainly depends on the host's ability to detect the B. burgdorferi bacterium. The bacterium conceals itself around healthy cells. The bacterium, the virulence factors of the bacterium, its main one is immune system avoidance. The spirochete does this through recombination of silent caskets. Another important virulence factor is motility of this bacterium. About 6% of the genome is devoted to motility. It utilizes a rotator mechanism in order to move through the blood. Twin motors on either end of the flagella allows for the bacterium to escape possible phagocytosis of larger cells. The bacteria eventually leaves the bloodstream into tissue which has significant less lactocyte. After a period of time, the bacteria can begin quorum sensing and biofilm development. The biofilm coats the bacteria and helps it be resistant to the immune system as well as some antibiotics. It allows bacteria in harder to reach areas live through antibiotics because smaller amounts of the drug can get to it. Quorum sensing is a system of stimuli and response correlated to population density. It allows the bacteria to alter the gene expression of other cells surrounding it.
Lyme disease is far easier to avoid than it is to treat. As such, everyone should be aware how to do so. First and foremost, where is Lyme disease common? As discussed in previous slides and on the provided map, it is seen that it is mainly an East Coast and Midwest problem. In the year of 2014, 96% of all Lyme disease cases were reported from just 14 states. Ohio was not among these 14, but it is still a risk area for Lyme disease. Unfortunately, there is no commercially available vaccine for Lyme disease at the current time. There was one, but it was discontinued back in 2002 due to a lack of demand. This means that the absolute best defense against Lyme disease is being knowledgeable and careful. The most effective way to avoid Lyme disease is to avoid wooded or brushy areas entirely. This is where ticks carrying Lyme disease are likely to be living, so avoiding them is advisable. Of course, most people will either want or have to enter these areas every once in a while. Taking precautions when doing so is highly advised. When entering the woods or brush, wear long pants, a sleeved shirt, and a hat if possible. The hat is especially important as hair makes an excellent hiding spot for ticks. All these clothes should be treated with permethrin, a cloth-friendly insect repellent, which will last through multiple washes. Any exposed skin should also be treated with skin-friendly insect repellent. Finally, once you return from the woods and enter your home, a thorough tick search should be conducted. Check all of the gear you were wearing or carrying. If you had a pet with you, check under their fur. Search your entire body and finally take a shower to make sure nothing is missed. If you are unlucky enough to catch Lyme disease, treatment can be a rocky road. If you are bitten, get a doctor immediately. You will likely receive an aggressive antibiotic treatment at this point. This treatment has great degree of success in treating short-term Lyme disease, but the patient may not be out of the woods at this point. Late or chronic Lyme disease is far less harmful, but it often appears in even those who are successfully treated for short-term Lyme disease. The IDSA, Infectious Diseases Society of America, and ILADS, International Lyme and Associated Disease Society, disagree over how chronic Lyme disease should be treated. The general consensus is to trust the ILADS on this, since it is an organization focused on Lyme disease specifically. There's no way to test for active infection at this stage. If you do have a doctor who follows ILADS guidelines, you will likely continue the antibiotic treatment until symptoms disappear. Thank you for listening to our presentation. Here are the sources, and that's all.